Sore nipples are a common problem many breastfeeding mothers face, especially in the early days of nursing. While it's normal to experience some discomfort as your body adjusts, here are some tips to prevent and treat sore nipples while breastfeeding. Check your baby's latch to make sure they latch deeply onto the breast, not just the nipple. A shallow latch can lead to pain and discomfort. To unlatch your baby, gently pull them away from the breast to break the suction. This helps avoid pain or injury when removing them. Always be gentle to ensure a smooth process for both you and your baby. Experiment with different breastfeeding positions to find what's most comfortable. Use pillows for added support to reduce strain on your body. If your breasts feel too full, express some milk to relieve pressure. This will make it easier for your baby to latch and nurse. A warm compress is a simple and soothing treatment for sore, cracked nipples. To apply, dip a washcloth in warm water, wring out the excess, and place it over your nipple and breast for a few minutes. Afterward, gently pat your skin dry with clean towel. This can help ease discomfort and provide relief after breastfeeding. Make sure you are using the correct size breast pump shield to prevent irritation. The right fit will help avoid nipple discomfort and improve milk expression. If your baby is teething, they might bite or gum your nipple while breastfeeding. To prevent this, offer a teething ring or toy during or between feedings. This can help soothe their gums and protect your nipples from discomfort. A sore nipple protector is a helpful tool designed to relieve discomfort and protect sensitive nipples during breastfeeding. The breast shells for sore or cracked nipples is designed to be placed in your bra, offering protection from friction and relieving engorgement. These shells help collect breast milk leaks, preventing shirt stains while easing discomfort from unexpressed milk. They provide a snug fit and reduce pressure on your breasts. Sore nipple cream is a soothing product designed to help relieve discomfort and promote healing for cracked or irritated nipples caused by breastfeeding. Lancino HPA Lanolin Nipple Cream is designed to soothe and protect sore, cracked nipples. It contains no preservatives or additives. Dermatologically tested, it has no taste, color, or smell, so there's no need to remove it before breastfeeding. This versatile cream not only comforts sore breasts, but can also be used for dry skin, nappy rash, stretch marks, or even as a lip balm. With the right techniques and proper care, you can prevent and treat sore nipples, ensuring a more comfortable and successful breastfeeding journey for both you and your baby.